Hi, my beauties. My name is Dr. Stefani Kappel, and I'm a board-certified, fellowship-trained cosmetic dermatologist in Newport Beach, California. And today we're going to be talking about cellulite. Now, I don't treat much cellulite in my office. I'm 100% cosmetic practice. I do mainly facial rejuvenation. I do body contouring, but cellulite isn't something that I regularly treat, but I wanted to put content out there for you guys because I recently attended a meeting and everybody was talking about a new cellulite treatment. And so I wanted to kind of like update the info that's on YouTube because sometimes people are lagging and not keeping up with the technology. And I wanted to have some information here for you guys for cellulite treatments, especially that spring and summer are coming up. Now, cellulite is very common. I think the studies show that over 90% of women have cellulite and men have cellulite. It's something just very common, but it could be, it can be anxiety provoking or, make you feel like not the best version of yourself, or anything we can do to make you feel more comfortable in your body and love the skin you're in. Why not do it? So cellulite is basically a phenomenon that happens from fibroconnective tissue bands that basically tether down the bands from the superficial most portion of the skin down to the underlying muscular fascia. And so it's kind of like a mattress. You have these tethering bands, and so the skin kind of puckers in those areas. And as we have a weight gain or loss, it can actually exacerbate the cellulite because a weight gain is going to make the adipocytes or the fat cells more puffy and bulge through, where you get that cottage cheesy look. Or you can have a fat loss even when you lean out and thin out, and then you get kind of like a concave, withered skin laxity that makes the cellulite go into this wavy form. So to be honest, I'm going to try to keep this video short and sweet, but the way you treat cellulite is to sever those fibroconnective tissue bands from the skin that are tethering down those dimpled kind of cellulite lesions. Now, there used to be a subcision. So subcision is the way that you basically lice or cut those fibroconnective tissue bands that are tethering down that skin, giving that dimpled, rippled appearance. There used to be a device called Cellfina. I don't even know if it exists anymore. I actually participated in the clinical trials for Cellfina. It was an amazing device. It was basically a subcision device that would suction up the area of dimpled cellulite, and there was a guided blade that we'd use to kind of sever those or release those adhesions. And so what that did was it would kind of float up the skin that wasn't tethered down anymore to give a very nice, smooth, beautiful contour. And it was FDA indicated for the buttocks and the posterior thighs. And actually we had really overwhelmingly amazing results with it. The problem with Cellfina, it was very expensive. It was very labor intensive. The anesthesia for it, the setup for it had to be sterile. I mean, I don't even know if I can find videos of me doing Cellfina back in the day, but it was like a huge pain in the to do this procedure because it was like you had to like have an OR set up, and the patient would have so much tumescent anesthesia. It was just a huge pain. And the results, yes, they were great, but it was a lot of time, money, discomfort, and a whole big situation that we would have to do to set up for this procedure. And it would take like over an hour. So now, recently I just attended the Masters of Aesthetics meeting, which is among only MDs, only experts attend this meeting. And when people talk, I listen because there's only experts who are talking about different procedures that are new, up and coming, and that they're doing clinical trials for with, amazing results. So it's so funny when you attend these meetings, you hear about like other little devices coming, up, and new and shiny toys on the market. And if it wasn't mentioned in these meetings with these world-renowned experts, it's not worth anything that's going to become anything amazing later on, because if it's amazing, you would hear about it at this meeting. So there was this lecture, or actually a couple lectures, on a procedure called targeted verifiable subcision, and that was for cellulite. I feel that so the trade name is Avali. I hope I'm pronouncing it right, Avali. And again, I don't perform this procedure in my office. I just want to keep you guys up and in the know with new innovative technologies and in cosmetic dermatology. Even though there are procedures that I don't perform in my office, I want to keep you guys in the know. If you follow me on YouTube, I will keep you updated because it's a rapidly advancing field. I attend all these meetings, I lecture, I'm at the podium, and I really love to be the liaison between the medical community and these dermatology cosmetic experts and you guys. No sponsorships, not through a company, not through media or Birdie or Pop Sugar. This is like straight from the meetings to you guys. So everybody was talking about Avali, which is the verifiable subcision, and it's used to treat cellulite. And it's a device that is similar to Cellfina, but without all the headache of the anesthesia and the bruising. I guess there is a little bit of bruising, but less bruising with this device because it's more particular, it's more localized, and it's more comfortable for the patient, and the results have been amazing. So basically what it is it's a little subcision device that goes under the skin, and there's like a light guided instrument that basically can verify that you have lysed the adhesions that are tethering that cellulite down. So the smooth contour of it is the result, and it works really well. And one of my colleagues, Dr. Jeremy Green, he's actually in Florida. I'm located in California in Orange County, but he was presenting on it. And when Dr. Green mentioned something, it's worth looking into. So if you guys want to follow him, he's a great dermatologist, and he was talking about this cellulite treatment. And so I wanted to share that with you guys. So other cellulite treatments, to be honest, aren't really that impressive. The best way to treat cellulite is to sever those fibroconnective tissue bands, or to do things to tighten the skin on top, or to add volume. Now, how do you add volume to cellulite? Usually with muscular hypertrophy, inducing muscular growth. I have an Emsculpt in my office. I use it. I love it. My patients are obsessed with it. Building muscle adds volume, and adding volume in a good way from muscle, not fat, makes the cellulite look better. Also, things that are going to help stimulate skin tightening, Sculptra, Thermage, or even tightening devices or products that are going to stimulate collagen to tighten the skin, makes cellulite look a little bit better indirectly. So directly targeting cellulite, targeted verifiable subcision or ovally would be best, but also diet and exercise. Exercising are going to grow exercising grows your glutes, grows your quads, grows your, I can't talk today. Exercising grows your glutes, grows your leg muscles, your quadriceps, your hammies, and it just makes the cellulite look better because you're adding volume and you're almost like stretching out the skin or making it less apparent, making that cellulite less apparent. Tightening the skin is also really important. Now, I love Emsculpt because it's not FDA approved for cellulite, but cellulite just gets better with it. People look better, they're more toned, they have more, volume in their booty, they have abs, but the skin and the cellulite just kind of falls into place and gets better. Now, it's not FDA approved for that, but it's like a side effect of it, which is an amazing side effect to have. So I love Emsculpt, and you're basically inducing muscular hyperplasia and hypertrophy by stimulating it with magnetic energy in a very safe and effective way. Emsculpt, the company, actually has something called, what was the name of it? Neo. And Neo basically has a skin tightening component to it in addition to the Emsculpt protocol where you increase muscular hypertrophy. But in my opinion, it doesn't really work well. I've seen before and afters. I've seen patients who have had it done at other offices, and the Neo tightening part of it isn't all that. If somebody did want skin tightening with muscle growth or hypertrophy, I would do an Emsculpt with a Thermage on top. You get the two players that do the best in their space or the best job at what they do. Emsculpt for muscle, Thermage for skin tightening. So, but again, those two treatments don't really address the fibroconnective tissue bands. For that, you would need either subcision or the targeted verifiable subcision to be effective. Now, Quo is an injectable cellulite treatment that got a lot of hype over the last couple of years, but there have been a lot of complications with it too. So that's why I love being non-sponsored, because I can say anything about any company and speak the truth. There were a lot of complications with that. I think it was more with hyperpigmentation, hemosiderin deposition. Basically what that means is you'd have a bruise that would basically stain or discolor the skin long term. Or you would have hyperpigmentation, which would be like a post-inflammatory hyperpigmentation. You would release melanin or pigment in response to the traumatization of the Quo, which was an injectable collagenase. It was an injectable collagen dissolving solution. Well, I don't think collagen dissolving is ever a good idea. They say that dissolving the fibroconnective tissue bands with collagenase would stimulate more collagen, but that doesn't make pharmacokinetic sense to me. It never did. I never bought Quo. I never incorporated it into my practice because I was always kind of skeptical, and I'm glad I was, because it really hasn't had that much well-received acceptance of that treatment. But now we have other different treatments that I think are better and engineered to kind of replace Quo, and Ovally is one of them. So other people may ask me about at-home devices. At-home devices can only do so much. Unless you're severing those fibroconnective tissue bands surgically with subcision, you're really not going to see much of a result. There may be a little bit of swelling from the traumatization if you're using these at-home devices at home, but they don't really work. I'm just being honest. Also, topical creams for cellulite don't really work that well. There's some that have a lot of data and research. Maybe they make a small percentage of difference, but again, if you're not getting to the root of the cause and severing those fibroconnective tissue bands that are causing the undulated, dimpled cellulite, you're not going to really see that much of a response. You can tighten the skin, you can bulk up the muscle, but you need to cut those bands for the most effective treatment. So that's my wrap up and my kind of quick and dirty video on cellulite. I hope this information was useful to you, and share this video with anyone who may find it useful too, and who wants non-sponsored content from a board certified dermatologist. All right, I love you guys. Thanks for your support.